Everyone knows dementia causes memory loss, but what if I told you the first warning signs have nothing to do with forgetting names? In fact, they can appear years earlier, and most people completely miss them. Sign 1. A surprising early sign of dementia is a change in your sense of smell. We often think of smell as just a minor sense, something nice for enjoying coffee or fresh flowers. But it's actually one of the brain's most sensitive warning systems. The nerve that detects scents, called the olfactory nerve, is directly connected to the parts of the brain that handle memory and emotion. In some forms of dementia, these brain regions start changing long before memory problems appear. That means a person might suddenly have trouble recognizing familiar smells, coffee might smell faint, perfume might smell different, or they might not notice the scent of food cooking at all. One study even found that difficulty identifying certain odors, like cinnamon, lemon, or gasoline, can be linked to higher risk of developing dementia within a few years. The key here is change. If someone's sense of smell suddenly shifts or fades without a clear cause like allergies or a cold, it could be an early clue worth mentioning to a doctor. Sign 2. Another early, lesser-known sign of dementia is trouble with visual-spatial skills. This isn't just about eyesight. Your eyes might be perfectly healthy, but the brain starts struggling to interpret what those eyes are seeing. You might notice someone misjudging distances, like pouring water and overfilling a glass, or stepping awkwardly on stairs because they can't quite tell how high the next step is. They might start getting lost in familiar places, even their own neighborhood, because the mental map they've relied on for years isn't as sharp. Driving can become more challenging too, not because they've forgotten the route, but because judging when to turn or how far away another car is suddenly feels harder. These changes happen because dementia can affect the parts of the brain responsible for spatial awareness and depth perception. And since we rely on these skills constantly, walking, cooking, even reaching for objects, small changes can snowball into daily frustrations. Sign 3. Before memory loss, dementia can quietly change who someone is, and it often happens so gradually that friends and family barely notice at first. These personality shifts aren't about someone having a bad day or just getting older, they're the result of changes in the brain's frontal lobe, which plays a big role in behavior, judgment, and emotional control. A person who's always been social might start avoiding gatherings or stop calling friends. Someone usually calm and patient might become irritable, suspicious, or even impulsive in ways that feel completely out of character. Sometimes the changes are subtle. Maybe they laugh at inappropriate moments, show less empathy, or seem oddly indifferent to things they once cared deeply about. Loved ones often describe it as, they're still here, but they don't feel like themselves. The tricky part? These shifts can be mistaken for depression, stress, or even just a phase. But when the change is persistent, and especially when it's paired with other signs, it can be one of the earliest red flags that something deeper is going on in the brain. Sign 4. Another subtle warning sign is trouble finding the right words, and I'm not talking about the occasional tip of the tongue moment we all have. In early dementia, these word-finding issues become frequent and noticeable. Someone might pause mid-sentence, searching for a very simple term. They may replace specific words with vague placeholders, saying that thing you write with instead of pen, or calling a refrigerator simply the cold box. Sometimes the substitutions are completely unrelated, which can make conversations confusing. For example, they might say chair when they mean phone, without realizing the mix-up. This happens because dementia can affect the brain's language centers, areas like the temporal and parietal lobes, disrupting how words are stored, retrieved, and connected. Over time, this can make conversations slower and more frustrating, both for the person speaking and for the listener. Friends or family might start stepping in to finish sentences, which can unintentionally make the person withdraw from conversations altogether. Sign 5. The fifth sign is one most people never connect to dementia: changes in handwriting or coordination. Dementia doesn't just affect memory, it can also disrupt the brain's ability to control fine motor movements. This means activities that require steady, precise control, like writing, buttoning a shirt, or using utensils, can suddenly feel clumsy or awkward. With handwriting, you might notice the letters become smaller, more cramped, or unevenly spaced. The smooth, confident flow of someone's signature can turn shaky or hesitant. They may even avoid writing altogether because it feels frustrating. These motor changes happen because dementia can affect not only the thinking centers of the brain, but also the regions that send signals to muscles. The result? Everyday tasks that once felt automatic start requiring more effort and concentration. It's important to note, hand tremors or messy writing can be caused by many other conditions, like arthritis or Parkinson's. But when these changes appear alongside other cognitive signs, they're worth bringing up to a doctor. These signs don't always mean dementia. Stress, vision problems, and other health issues can mimic them. But if you notice these changes, especially in combination, it's worth seeking medical advice early. Early detection can make a world of difference. If you found this helpful, share it with someone you care about, because awareness is the first step toward prevention and support.